everybody. My name is Olotu, Deborah, and I'm here to present the topic infection control. Before that, I have my table of contents here from slide 1 to 10. What is infection disease up to levels of health prevention? So these are what I'll be discussing about. So first of all, I'll start with what is an infectious disease. Infectious diseases are diseases caused by microorganisms like bacteria, fungi, protozoas, worms, and viruses. Oftentimes we can call them pathogens because they are disease-causing microorganisms also.
Great. Can I say pathogens? Can you give me an example of a pathogen? Bacteria. What else?
Virus.
What else? Yes. What else? Protozoa. Can you give me an example of a fungal infection? Huh? Worms? Ringworms? What else? What do you get from the toilet? Athlete's foot, right? What do you get in your hair? Fungal infection. Lice, dandruff, but lice is not a fungus. It's a form of parasite, right? Can you give me a viral infection? COVID is caused by coronavirus. What else? Can you give me an infection, B? SARS is also caused by a virus. What else? How about bacterial infection? Urinary tract infection could also be caused by bacteria. What else? How about TB? TB is caused by bacteria. How about chicken pox? What is chicken pox? It's a virus. HIV, it's caused by human immunodeficiency virus din yun. O, diba? So yung mga example, those are called pathogens. In simple terms, it's called germs. In medical, we call it pathogens or microorganisms, right? So how do we get that, Olotu, Deborah?
So they can be spread in several ways. For example, through direct skin contact, and a very good example of that is COVID-19 also. Then dressings, you can dressings like open wound, like tetanus.
Yes.
For example, animals or insects ingesting.
Can you give me an example of infections caused by animals? Rabies. What else? What do you get from the rats during the flood? Leptospirosis. What else? How about mosquito? Can they cause infection also? Dengue, ano pa? Malaria, and so on. Okay, next.
Ingesting contaminated food or water like cholera, diarrhea, inhaling airborne particles or droplets, then touching an object that a person carrying the pathogen has also touched. Then we also move to risk factors. This explains people that are greater risk for getting infections. Number one category of people is people with weak immune systems, like young or elderly people, because they have low immune system, so they are likely to be infected, and also people on medications that suppresses the immune system. People with
For example, example of Chris Aquino, like she has a autoimmune disease, right? So her her immune system is very reactive, that even her own cells, her own body is being killed by her own self, right? So what they do, they lower down their immune system. So she's very at risk for infection. People also with that's also immune system. How about people with chemotherapy? Diba in chemotherapy, they kill the cancer cells, right? And they also kill the good cells. You know, sometimes their hair are falling because it's a good cell. It should not be killed, right? But a side effect ng chemotherapy is yung hair mo is also fall. So, and also your immune system basically will be lowered. So for us, it's just a regular cough, but for them, it's already pneumonia. It could also be TB na, right? Sad. Next, organ transplant patients. Why do you think organ transplant patients are very risk for infection?
Yeah, because most of their they have some their system is like it's not special.
For example, she's the recipient of my kidney and I'm the donor. I'm the healthy one and she has a bad kidney. her kidney is dead, then I'll transfer my kidney to her. You understand, right? So now, since we have, you remember we have an antigens and we also have an antibody. Remember that? Antigen and antibody. Antibody is our friend, antigen is our enemy. So basically, my kidney, even if it's good kidney or healthy kidney, it's not part of her body. So what will happen is during the organ transplant, they will lower down her immune system. Parang patulugin mo na lang yung immune system nila. Then they will put my kidney to her system so that when her system is back and active na, they will not notice that she has a new kidney. Otherwise, if her immune system is very strong, the moment that my kidney is placed into her body, then automatically the body will tell, oh, this is not her kidney. Then they will just kill the kidney, the healthy kidney. You understand? So parang inaano mo yung system niya, parang tinitrick mo yung system niya na, oh, matulog ka muna, lalagyan ka ng bagong kidney. When you wake up in the morning, and her immune system is already activated, then they will not notice na may bago na palang kidney. Kasi during the time of transplant, she has a lower immune system. Do you understand? So during the kidney or the transplant mga panahon, her immune system is very low. Same with people with HIV and AIDS, and also people that are not eating healthy foods and not sleeping enough. Are you guilty of that?
Yes.
So we are at risk for infection. See what happened to me. Next.
So we move to chains of infection. So first of all, we're starting from the germs, which is the agents, the infectious agent, the pathogens, bacteria, viruses, and parasites. Then also we move to the reservoir, which is where the germs actually lives. This is like people, food, soil, water, animals, and wild animals. So these are the places where the pathogens tend to replicate and live. Then also we move to the portal of exit. This is where the germs get out. That is the mouth, the cut in the skin, then during diaphragm and toileting, then stool. Also, we move to the mode of transmission. This is how the germs are being transferred from one person to another. For example, droplets, the contact, like hands, toys, and sand. Then we also move to portal of entry. This is where the germs actually get into the body, like mouth, through the skin also, and the eyes. Then lastly, this is the susceptible host, that is people that are very that are at risk of getting infection. The children, the babies, elderly, and people with lower immune system or unimmunized people. So this actually describes what the chain of infection. So we move to the policies and guidelines. This explains the process of preventing infection, how we can control infection. Then we have two types of precautions here. We have the standard precaution and the universal precaution. First of all, I will talk about the universal precaution. It's an approach to infection to control, to treat all human blood and certain human body fluids. And standard precaution actually is used to prevent not only blood but body fluids, wounds, and mucous membrane. So how do we perform this standard precaution? We can perform them by two major methods, like the hand hygiene and the use of personal protective equipment.
Can you also say standard precautions? Say standard precautions.
Standard precautions.
Are you familiar with that, na? Diba, if you're working in the clinic or in the hospital, automatically we have to treat everyone as infectious. My phlegm, my poo-poo, my ihi, my urine, everything, my blood especially, we'll consider that as infectious. So when you're handling those kinds of patients or in general in the hospital, you have to observe standard precautions. So ititreat mo lahat is masama and makakasama para sa'yo. So do not touch somebody else's blood with bare hands. Instead, use your PPE. What does PPE stands for?
Personal protective equipment.
Yes, Maribel? O ano daw? What is PPE? Personal protective equipment. So, PPE, personal protective equipment. Standard precautions. Next.
So we move to the procedure.
We're done with the hand hygiene, right? There are two types of hand hygiene. What are those? Hand washing and hand rubbing. Okay, next.
So this is
Next na.
moment of hand hygiene. This is just the process of of destroying germs from our hands. Like, what are the things we need to do before and after touching our patient? So first of all, we need to wash before touching the patient. We just need to perform all the hand hygiene. Number one is before touching the patient, like before, after, like introducing yourself, before touching them. Then two, before cleaning or aseptic procedure, possibly maybe bed bath. Then three, after body fluid, maybe after taking out the urine from the catheter or blood or whatever, you are expected to perform your hand hygiene. Four, after touching the patient also. Then lastly, after touching patient surroundings, after bed making or whatever, you are supposed to perform also the hand hygiene. Then we move to the
We know that already, right? We're done with that.
Yeah.
Nag-perform na ba kayo ng hand hygiene? Okay, next.
So personal
Okay, here, show me.
protective
Show us.
equipment. So these are the equipment requires in the PPE, that is the protective personal equipment. First of all, you need your gown. This is an example of a gown. You can see an example of a gown. Then you should have a cap, although I don't have my own cap. Hair cap here. Then from the hair cap, you have your goggles, which is used to protect the eyes. The head cover is used to protect the head. Then we also have the mask also to protect the nose. Apron, the gown and apron, they goes together, but I don't have my apron here. Then gloves to protect the hand from cross-contamination. Also the shoe covers and this face shield to protect the mouth, the eyes and the nose. So this is how a full personal protective equipment should be. I don't know if I'm to bear mine or should I wear it or just...
So can you finish first, then we'll do it together. What is in your slides?
Then donning and doffing.
What do you mean by donning and doffing?
Donning means the act of putting on PPE, while doffing is the act of removal of PPE. First of all, before wearing our PPE, we are supposed to wash to perform the hand hygiene. Then from there, you put on your gown. After you put on your mask or respirator, then from there, the goggles or face shield, and lastly to your gloves. Then also, doffing of PPE, that is the act of removal of PPE. First of all, you wash your hands also. Then
you wash your hands later because you're wearing gloves first, right?
Okay,
So
yeah.
you remove your gloves.
Remove your gloves. From there, you remove your goggles also. You remove your gown to your mask. Then wash your hands as the last.
Okay, next.
Then we also have.
Okay, that's okay. We'll do it later. Next.
Okay. The levels of health prevention.
No, that's okay. Next.
I think
That's it? Okay, thank you. All right. So now, can you go back to the slides of donning and doffing? What is donning again? What's donning? To wear. Parang you just have to remember the word on and off. Okay? Don or on, donning is to wear. Doffing is to remove or off. So all you need to remember, guys, is the sequence of the donning and doffing. This is according to the CDC. CDC is an organization that parang sila nagkikater sa lahat ng mga infection control. Okay? So we're gonna do that all together. Yung first is your gown, mask, respirator, goggles, and then your gloves first. Okay? So can you all prepare that and we'll do it together?